We're talking about postpartum depression in this week's KidCast. I'm Kristine Sorensen here with Dr. Edye Moses-Kolko, Associate Professor of Psychiatry at UPMC Western Psych Hospital. And first of all, how common is postpartum depression?
Well, it could actually be pretty common and occurs also in pregnant women. About 1 out of 7 women can have some symptoms of perinatal depression.
And then there can also be anxiety.
Right, so depression is sort of the depression you'd experience at any time of life with lack of interest, lack of motivation, low mood, decreased appetite or increased appetite, decreased or increased sleep, guilt, feelings of hopelessness and worthlessness. And in a lot of perinatal women, both pregnant and postpartum, there's a high prominence of anxiety. And this occurs when women are worrying continuously. They tell us that their brain won't stop. They often can't sleep because they're up thinking about things that they need to do, wondering if the baby is okay. It's normal for women to come home with the baby and want to check on their baby's breathing, but for women who continue to do this for months after their baby comes home, it's excessive and it gets in the way of their own function.
So if a woman's watching this and she realizes she has some of these symptoms, what should she do?
For starters, we talk about common sense strategies like taking time for yourself, taking care of yourself, getting people to support you so you can get a break from watching the baby. We also think exercise is really important to mental health, getting a chance to shower, getting a chance to eat a meal, getting a good night's sleep, having your spouse take over for childcare in the middle of the night, or a family member who can spend the night and care for the baby can really go a long way towards feeling better. It's important to talk to other people. It's important to talk to your partner, talk to other friends, let them know what you're going through, what's on your mind, and get some support from them. If you're feeling like you really can't cope and that you're really so anxious that you need some professional help, you can often call your OB/GYN or your primary care doctor. There's increasing understanding about postpartum depression and they may be able to prescribe a medication for you or refer you to mental health services so that you can get psychotherapy.
And then there are some symptoms that are more serious, where if a woman's experiencing those, she should go to emergency care. What are those?
If you're not able to sleep at all for days on end, if you're feeling confused and unable to take care of yourself or your baby, if you're agitated, suicidal, if you're having thoughts to kill your baby that you actually think you need to follow through on, these are all reasons to seek emergency care immediately.
All right, well, thank you so much, Dr. Moses-Kolko, and we have a lot more information on postpartum depression and anxiety and more resources at kidsburgh.org, and we have a link for you at kdka.com/kidsburgh.